And during the initial needs assessment and talking with a few colleagues in different regional offices and country offices, it's a topic of utmost importance for the national rapid response teams, not only on issues of personal protective equipment, but also how to protect oneself and be able to deal with somewhat of a community which sometimes may be reluctant to follow the measures, uh, to um, to adhere to these measures, which may appear to be strict, may appear to be coming back again, developing a certain fatigue, I guess, with things. So as members of the National Rapid Response Teams, you're obviously very exposed to a number of people's reactions, and it's important to be well protected during the course of this pandemic, which is going to last and going to be with us for quite some time in the future. Unfortunately, we can say probably through 2021. So it's a very important topic and subject matter area that we will deal with here today. And we're very fortunate to have had the collaboration from experts in the regional offices, CRO, AFRO, EMRO, and also from headquarters. So for those who may not have, who are joining us maybe for the first time, this is a series of 4 webinars that we have prepared for National Rapid Response Teams. These are, and this is the number 3. Basically, what we propose is a 3-step process to reinforce the learning and the skills of members of National Rapid Response Teams. And the first step consists in exploring and completing modules that were provided and put together and made available on the Health Security Learning platform. So these are modules, 11 modules that deal with COVID-19 for National Rapid Response Teams. So you can complete the modules that are more relevant to your specific areas of interest. You can encourage other people who may not have the chance to participate in these webinars to complete other modules. If you're part of a team, you may wish to engage the team, the National Rapid Response Team or the local team in the discussion of which modules to take. You may also want to take all the various modules, and that should not be a scary project. There are 11 modules, but to complete a module takes about 20 to 30 minutes. So altogether, roughly 3 hours to complete the entire package. So that's the step 1 is to access these learning modules online. And if you haven't yet done this topic, there is one on occupational health and safety. You can do it afterwards, no problem with this. The second step is this webinar, and this webinar is a way for us to interact with colleagues from all over the world. In the first 2 webinars, we had people from ranging all over from Vietnam, so that's good evening to you people out there, to Trinidad and Tobago and St. Kitts and Nevis, and that would be good morning to you, and a lot of many countries in between, so it might be end of the morning or early afternoon. And welcome to everybody in this webinar. And the third step in terms of learning and continuing to engage in the learning process, because this epidemic, again, pandemic, is going to remain with us for some time. So there's already a lot that you have learned in the previous 6-7 months in addressing this epidemic, and will continue to learn over the next few weeks and months. But I'm just going to take a sip of water here to help my voice. So, and one of the goals that we have through these webinars is to facilitate the interaction, the exchange of experiences a little bit between all of you seasoned professionals in this context, but to continue the conversation, because we're time limited during this webinar to 2 hours. So it's very short and concise, But we want to invite you to continue the discussion through what we call the National Rapid Response Team's Knowledge Network. And we will have somebody who will present to you how to be part of that if you're not part of that already. And that will basically provide you opportunities to continue sharing your own experiences, the success stories, the challenges that you encounter, the asking for solutions from other colleagues on how they've handled a similar type of situations potentially and things like this. And that there is no dead line for this. The conversations continue on an ongoing basis. Next slide, please. So this slide kind of like shows you all the various modules that we had. So we started with active case finding and contact tracing. Last week, we had community engagement. So this week, occupational health and safety. And next week, we have, if we can click one more time so that we have the fourth topic appearing. Data management and dissemination. And so if you missed one of these topics are recorded. So you can absolutely participate, I mean, and still, you know, have the benefit of listening in to the webinar because these topics have been recorded. At the same time, and we'll mention this a little bit, we're considering adding on 2 topics in November, but we'd like to have your feedback on that. And I'll come back to that point a bit later. Next slide, please. So webinars in November, that's exactly. So we are we are actually conducting a survey to see what topics would be of interest to you. And so we have the 6 topics that you can see here on your screen, hopefully. So collaboration with between EMTs, emergency medical teams, and rapid response teams, the management of COVID lab samples, role of rapid response teams in the context of a pandemic, long-lasting pandemic, cross-border collaboration at points of entry, lockdown, quarantine, and RRT management and supervision in the context of COVID-19. For this, to complete this survey, you have a link that is provided to you, and we will also send this link to everybody who has registered for this webinar. Next slide, please. So what were the key learning points from the previous webinar? Previous webinar dealt with community engagement again. But there may be a natural segue in between the previous webinar and this one, since part of the occupational health and safety has to take into account the engagement with the communities. So it's a key component of the team's work to understand perceptions and behaviors, and that very much is any time we conduct these national rapid response teams, training is a super important topic of interest to all the team members. So then there are different definitions in terms of how these communities can be constituted. So it's not just a community, a geographic community, but it could be a social community, it can be virtual communities, etc. And within these communities, there are some key people with whom it is most important to establish a linkage. And because these people have influences, they are influencers, whether they're informal or formal, and it's important to recognize both probably in order to move ahead with our agendas. And communities have their own agendas, their own priorities, and it's kind of essential to take these into account as planning forward. So that these were the key learning points from the previous webinar. Next slide, please. Or I believe that might be the last one for me.
Yes, I'm going to give the floor now to our colleague Katrina to present the Rapid Response Team Knowledge Network. Thanks very much, Philippe, for this overview and this introduction. It's to you, Katrina.
Thank you very much. Hello, good afternoon, good morning, and good evening, everyone. So I am Katrina Nitam, and I work with Paula and Philippe in the Learning Solutions and Training Unit in Lyon. So before we proceed with the webinar proper, I'd like to share with you more information about the RRT Knowledge Network that Philippe has kindly introduced. So here we have, thank you, here we have a visual representation of the RRT Knowledge Network, or the RRTKN, which some of you might already be members of. So briefly, it was established in 2015 to facilitate the exchange of knowledge and experience among RRTs as a follow-up to the RRT trainings done in the African and Eastern Mediterranean regions. So the RRTKN is like a container where new knowledge is shared and generated through various mechanisms. So here we have in the boxes some examples of those mechanisms. We had face-to-face meetings, pre-COVID, planned discussions, which we have recordings of on our YouTube channel. We have newsletters that contain the activities and the trainings done by our members. And then we have the ongoing chat discussions on WhatsApp. So how are these webinars from the RRT Global Virtual Learning Series connected to the RRTKN? So this webinar is also a mechanism which contributes to the production of new knowledge or shared knowledge. Next slide, please. So during registration, you were asked some specific questions on what issues you would like to see addressed or elaborated during the webinar. So here we have on the colored post-its, some of them. So I'll just read them out loud. So which PPE should you have during active case finding? How long shall we screen staff for dealing with COVID-19? How do we carry out COVID-19 surveillance among health workers and other frontliners, testing frequencies and quarantine time? How to adhere to policies on occupational health and safety when resources are limited? And different types of protection and safety measures for each level of exposure to risk. So these are just some of the many questions you sent in. And again, so this webinar is an opportunity for participants and facilitators to share their experiences, learn how others address your questions, and search for the answers together. If at the end there are unanswered questions remaining, then the learning continues through the RRT Knowledge Network. So a quick note on the platforms that we are using for the network. So at the end of this webinar, we will be sharing with you the link to join one of our platforms, which is on Microsoft Teams. So currently, the RRT Knowledge Network is most active on WhatsApp, but we are full at full capacity for now. But we have started the migration to Microsoft Teams, which is better able to fulfill what we want to do with the network. So it might not be as user-friendly or as familiar to a lot of you, but at the end of the link, at the end of the webinar, apologies, in addition to the link to the network, we'll also be sharing a link to a short video that will tell you more about what Microsoft Teams is and what it can do. So we would appreciate you joining us, and we look forward to seeing you there. Thank you.
Many thanks, Katrina, for giving us a flavor of the Rapid Response Team Knowledge Network. We are now going to remind a few of the house rules we would like the group to keep to in order to be able to participate smoothly to this webinar. So as I've indicated earlier, we kindly ask you to keep your microphone muted, to disable your camera. And of course, you are welcome to introduce yourselves in the chat box, which you have already started doing. And by the way, we have already, at this point, 109 participants from a variety of countries. So you are all welcome. Yes, and then please have your smartphone ready, because we will be using that to participate to the webinar activities. And another point about the chat box is that you can, of course, use it to ask questions, request clarifications, make contributions, but also we would like you all to feel free to respond to questions on the chat box. Participants you have all a lot of experience and expertise in responding to public health events, including COVID-19. So you are also the experts. So we want everybody to be able to share his or her experiences, and not only the experts, facilitators invited to facilitate the session today. So yes, so as said earlier, we would like you to use your smartphone to participate in some of the webinar activities. And for that, I mean, we want to have a first test of the application we will be using, which is called Slido. And you can now use your smartphone, scan the QR code that you can see on the screen, or type slido.com on and as a password RRT2 to join the Slido poll. So Silvio, I let you continue with the Slido.
Okay. Hello everybody, my name is Silvio Mena. I also work in the training team based in Lyon. So I'm going to show you the application Slido. So for those who arrived for the first time here, you simply have to type slido.com on your phone, on your browser, or and then type the password that is RRT2, or you can scan, as Paula just said. And now I will click on play. And we have this question that is, have you participated to any of the 2 previous webinars of the RRT virtual learning series? You can see that we have already 26 people who replied. It's much faster than before. I think there are not only newcomers with us now. Or we are better in instructions, giving instructions. So yeah, it's true that 70% so far are with 7.3. Yeah. So this icebreaker make us understand that you know how to use the tool also. Okay. This time, how many people are connected?
So
119 people are connected, including the facilitators.
Yes. So please do your best to join through Slido for the activities. But if at all you feel that you cannot join using the link or scanning the QR code, you can also respond on the chat box. That's one of the options if you cannot really join using the application.
So we'll wait until, let's say, 85 people.
Yeah, 85 would be a great rate of participation through Slido.
But anyway, I will not stop this poll when we go to the next slide. So for those who have some difficulties to get to access Slido, will be able to do that afterwards.
Okay, so you mean that we can continue the presentation,
yeah,
and people
we can move
still
on, yeah.
Okay, that's good.
We have 78 people, almost 80. So let's one
good.
more, please. Otherwise, I will feel alone. Please, I don't want to beg.
79 people have been able to respond to the question using Slido. Will we have an additional one? Okay, let's not wait for the additional one. But you can still Yes, great.
Thank you very much.
You can, those who have not responded can still respond through Slido.
Paula, I give you the floor.
Thank you, Silvio. So, yep. Good. So we are now going to enter into the hard content of the webinar today. And today we have a group of 3 colleagues who have developed the content of the webinar and who will be facilitating. So we have Dr. Leslie Onion from the regional office from Southeast Asia. We have Dr. Lubambo Demba, who is from the African region. And we have Dr. Ivan Ivanov, who is from HQ in Geneva, WHO HQ in Geneva. So to start with, I want to give the floor to Dr. Lubambo Demba for the introduction. Dr. Lubambo, is to you.
Thanks, Paula. Good morning, colleagues. It's a pleasure to be there. And let's start with the learning objectives. After this training, this webinar will enable participants to assess key risks to health and safety of rapid response team members in the context of COVID-19, in the field response to COVID-19. It also helps to apply measures for management of key risk when we are responding to COVID-19 in the field. And thirdly, it assesses key risk to health and safety of rapid response team member at the post-deployment phase and review culturally responsive measures for their management. Next slide, please. So in terms of introduction, what can we say? Occupational health and safety effort aim to ensure a healthy, safe working environment, to prevent work-related disease and to promote health. The occupational health and safety need to be considered at all stages of incident response, saying from preparation, during the response, and during the recovery phase. The occupational health and safety issues may affect the rapid response team itself, as well as the incident being investigated. So the risk assessment should consider the tasks, the environment, and the exposure, as well as preventive measure control available. Next slide. I think this will move to case study.
Thank you very much, Dr. Demba, for this quick introduction. We are now going to ask Dr. Leslie Onion to take the floor to continue with the case study.
Thank you, Paula. So to get us orientated, we wanted to select a real life example. So we're imagining that that you are part of the rapid response team, and you've been called to investigate a COVID-19 outbreak at a garment factory. As a result of routine contact tracing, the garment factory has been identified as a common location for a rising number of COVID cases in the country. As I said, this is a real life example, and so we see this now occurring from time to time, and maybe some more, but we might have a country which has successfully got the COVID-19 under control. However, we have this possibility for outbreaks, even against a background of low community transmission. In this particular case, 1,000 cases of COVID-19 have been identified with links to this particular factory. So you, as part of the rapid response team, are called upon to go and investigate this potential outbreak. So I think that next we have a series of interactive questions that we'll just go through to orientate you into the webinar. So the first question, which is shown on this slide, is we would like you to name 3 occupational health and safety factors at the garment factory itself, which could be contributing to the possible outbreak. So could you use the Slido to name 3 occupational health and safety factors which could be contributing to this possible COVID-19 outbreak?
Silvio, can we see the scenario or?
Oh, that's correct.
No?
Oh, I forgot to, that's an issue.
Okay. So we have people, you can still see the scenario when you use your phone, and the scenario you have the possibility to look at it.
Yeah, you can zoom in on your phone.
Yeah, and so what we're seeing now in this cloud that's being developed is that the size of the words that you see on the screen are the sort of answers people are making. So a lot of people are identifying the crowded workplace as a factor, and we know that garment factories are very crowded working environments, so that's certainly the case, and overcrowding, yes, that's coming up too. No personal protective measures among the workers, social distancing, lack of ventilation, enclosed working space, using the same machines for work, no distancing. So these are all very good answers. I think overcrowding and a crowded workplace is certainly coming up as the number one response in many forms. And certainly we know that from the transmission of COVID-19 that would be a very key factor, crowded places, crowded workplaces, poor ventilation and so on. So I think that you might have also, some people have identified overwork. Obviously long working hours also extends the potential for exposure. A lack of awareness about the problem, and obviously lack of awareness against preventive measures, that's important too. Nobody has picked up yet about possible issues that might happen at the end of the work shift, and where some of these workers may go after the end of the work shift, whether they could be sharing their accommodation, for example, or whether they're traveling long distances using very crowded transportation. So that's also an issue that we would flag. And also perhaps nobody has mentioned the lack of social measures such as sick pay and so on. So many of these workers may be encouraged to continue working even though they're not feeling well, and they may be experiencing some symptoms of COVID-19. But I think that we've picked up a lot of the key issues here. So I think we could move on to the next question. Thank you for your response. 70 people responding. I think that was quite fun to see the answers coming in. Thank you. So the next question is what PPE items, what personal preventive equipment items should the rapid response team wear for their investigation at the factory? It's in the context of the COVID-19 pandemic. So what are the PPE items? And I think this is a checkbox response that you should see on Slido. I'm not sure whether you...
Yeah, we have 8 items. I mean, gloves, double gloves, medical mask, goggles. Yes, sorry. Or maybe I can show it. Yeah. But I will check if it doesn't stop the process. No, we see on live the result.
So 35 people so far responding. So let's keep going. We have a range of possibilities: gloves, double gloves, medical masks, goggles, face shields, face piece respirators, aprons, and head covers. So a whole gamut of equipment you could take there. Should we wait a bit longer just to see?
Yes, we can wait, I think, some more time. Of course, for those who cannot join us on slido.com, you can also write down your answer in the chat box. Yes, Paula?
Silvio, the vote is closed.
Oh, it's closed.
Voting closed. That's what I see in my,
Because you voted already.
No, I did not. No, I did not, but it is true. I had a message
Sorry about
from
that. Sorry about that.
Chat box. So is that possible?
Now it's reopened. It's when I am back on this page.
Good.
So we cannot see live, unfortunately. It seems so.
Thank you. Thank you.
Okay. I think it's fun to see it live, Silvio, but in fact,
I agree. I fully agree.
Okay.
There's a compromise.
Now responding, so that's good. Thank you all for bearing with us with this.
62. So yeah, I think there was many people were blocked. So maybe I can.
Yeah, so let's look at the answers now, I think.
Yeah. So the correct answer are.
So we've got a lot of people selecting gloves and medical masks, which are the answers which we felt to be the most appropriate. A lot of people thinking that's face shields. Can we go down the list, Silvia, to see if there's any other? Okay, so a lot of people thinking that face shields were also appropriate. In fact, we refer to the WHO guideline on the rational use of PPE equipment. And in that guidance, really for the rapid response team going to the investigation, they may be triaging or interviewing people, that it's really only essential to wear the gloves and medical masks. If there were, that's what we considered as the faculty preparing this, and also that aligns with the WHO guidelines. Of course, if the team's getting involved in any clinical examination or taking samples, then likely to be exposed to some droplets or liquids, then the face shield could be useful, but much more we'd see that the interviewing and the basic steps that the rapid response team are taking should be done at a more socially distanced and a separate location, perhaps outside and so on. So according to the WHO guidelines, only medical masks and gloves would be essential, although you would obviously have other pieces of PPE in your equipment should you need to use them. So let's move on to the the last question in this little set. So the last question is that, so you're at the factory, you're doing your investigation, and 3 of your team members have started to develop some skin irritation. We'd like you to think about what the main cause of this could be. And this is obviously sort of hypothetical in many ways. But what could be some of the causes of the skin irritation that could be seen? And again, this is a multiple choice question, so you have some potential answers on your screen. I hope it's not too hypothetical a question, and let's see what the answers are. So
we are replying very fast, so
nearly 50 people. So
maybe I can. No, let's see. We had just 66, so at least 66 will be good.
Okay.
To be fair.
Okay.
64. Okay.
Let's see what
more people. Sorry for the others.
Okay. Okay, well, that's very good. I think almost everybody has identified that it's a type of disinfectant and sanitizer used for intense cleaning operations at the factory could be a cause of this. So well done. I mean, this is something, again, which, although this question is hypothetical, we often get a lot of questions about the use of disinfectants. And initially at the outbreak, there obviously was a lot of uncertainty about what types of disinfectants could be used, and a shortage in some countries of the correct disinfectant. So it could be that the type of disinfectant is not the most appropriate, one that could be one that's known to cause more skin irritation. Obviously, the disinfectant being too diluted wouldn't necessarily be thought of as a reason. It would be more like the disinfectant was too concentrated. So, and food consumed in the workplace, well, obviously that's not a recommended practice, but this is skin irritation amongst the team members, and so you certainly wouldn't expect the team members to be consuming their lunch whilst they're investigating. So thanks for that. Thanks for your participation. I think that's a very good response. Over from me, Sylvia.
Okay, thanks.
So yes, thanks so much, Leslie, for introducing the topic with this case study, and thanks to Silvio for facilitating. Thanks to participants for being engaged into this activity, which enables us to see some of the aspects of occupational health and safety related issues. So now we are going to enter into more details of this topic with Dr. Ivan Ivanov. So Ivan, I'm giving you the floor to start with your presentation.
Okay, thank you very much, Paula. Good morning, good day, good afternoon, good evening, everybody. I'm Ivan Ivanov, and I'm an expert in occupational health in headquarters of WHO in Geneva, and I'm also working very closely with our emergency preparedness and response program dealing with occupational health and public health emergencies. So I'm addressing you as rapid response team members, and the rapid response team members work in so diverse situations, like you can see on the background, my artificial background in Africa on open air, but also visiting hospitals, visiting communities. In this case study, we also had visiting a garment factory, or there might be other workplace settings or schools to investigate the diseases and outbreaks and what is happening there. So it is very important to be healthy and safe, that they can fulfill their work without getting a disease, without getting an injury. And being healthy and safe is a matter of personal, of course, priority. You cannot help the community if you get sick also, but also if rapid response team members fall sick after a mission in the village, that certainly would jeopardize the purpose of the mission and how the community members will think about rapid response team, as if they cannot protect themselves, how they can protect us. So there is also a reputational damage that can be caused. Therefore, I'll talk to you about how to make sure that you are healthy and safe during all phases of the mission, preparing for the mission, personal and team preparation, during the travel to the setting, the selection of accommodation, food, how to work in the field, how to monitor your health, how to manage contacts also from COVID-19 if you happen to have to get in contact with COVID-19 case, and how to return and how to follow up after the mission. Next slide, please. it is certainly very, very important to have a good preparation for the mission, to have a clear idea where you are going and what you will be doing and what you can expect there, and have all potential risks covered. That's why there is a more detailed training module on occupational health and safety that covers all risks that you may encounter for when you are doing a rapid response mission. But here today, I will focus only on the specific risks related to COVID-19. But we should not forget that anything can happen and that we don't want anybody to get injured because of traffic or because of violence in the community or to get other diseases, for example, poisoning, food poisoning or chemical poisoning. So it is important to consider all risks. Therefore, the individual, personal and individual preparation needs, of course, you have to tell your family that you'll be away to deal with your personal matters, how long you have to be there, all the insurances, make sure that you have, and the personal health needs. IPC means infection prevention and control. So you have to also be prepared what kind of infection prevention and control measures you have to implement with the specific mission. What is the main risk? What is the main pathogen that you could expect? But also be aware that in a community setting, you can face any different pathogens. So this is very, very important. The team composition should include at least one staff member, one member of the team who has taken at least the recommended WHO course on occupational health and safety for rapid response teams and who is aware of the different risks. So it is also important to have a clear division of tasks and responsibilities among the team members, and one person should be assigned to monitor health and safety of the team members during the mission, and also that person should be very well familiar with the infection prevention and control measures, not only for COVID-19, but you may face also other infections, you may face other, you don't know what is happening there. It might be meningitis, it might be other dengue, it might be other diseases. It is also important to collect existing information and to conduct initial risk assessment of the setting. For example, what is the level of community transmission in the place where you are going, and what other risks there might be also involved. And therefore, based on this review of the tasks and the potential risks, you have to select the adequate personal protective equipment. Of course, make sure that you have enough alcohol-based hand wrap in sufficient quantities, and team members should be briefed about the protective measures for their health and safety. So everybody should know how to keep healthy and safe during the mission. Next one, please. The team preparation is very important. It requires first a medical briefing. Many of the rapid response team, they have their first aid kits, but it may be necessary to add a personal thermometer and prophylaxis measures. For example, if you're going to a place where you can expect malaria or mosquitoes, so you have to carry malaria prophylaxis and repellent. It is important also to have a medical clearance for going to that mission. For example, for COVID-19, we do not recommend personnel with underlying medical conditions, pregnant women and age above 60, to be sent to travel to COVID outbreak settings. It is also important to have a flu vaccination, not the day before the mission, but well in advance at the beginning of the season, according to the local recommendations. Security briefing is very important. So you don't know where you're going. You need to know where you're going, what kind of security threats you may face, and how to address these threats, how to protect yourself, and also how to choose and plan a safe transport and safe accommodation well in advance. Next one, please. For transport, it's very important to choose the safest possible transport to avoid crowded, enclosed vehicles, dallas or different taxis or public transport, to use a natural aeration when you are traveling by car, open the windows, or if it is too hot, at least use the air conditioning, but without recirculation. And if you have to have several people in the same vehicle, then physical distancing cannot be observed. So everybody, including the driver, should be wearing face masks. We need also to make sure that other safety rules from road safety, seat belts, speed limits, the technical condition of the vehicles. If you're traveling by boat, make sure that there are life jackets on the boat. If you travel by motorcycles or bicycle, make sure that you have helmets. All these need to be observed. We don't want anybody to get injured. Then a regular hand hygiene and respiratory etiquette should be, of course, observed during the transport. Whenever you commonly touch objects, or before touching your face, mouth, nose, eyes, perform hand hygiene. Usually that would be with alcohol-based hand rub, or if possible, with washing with running water and soap. And respiratory etiquette, make sure that if you cough and sneeze, do that in your elbow or in a tissue. Dispose the tissue in a closed container and perform hand hygiene with alcohol-based hand rub, or wash your hands after that. It is very, very important to keep physical distancing at least 1 meter from others. You don't know who is there. You don't know what is their situation, where there are a lot of asymptomatic people who are still shedding the virus, and people who usually 2 days before they become symptomatic, they start shedding the virus. So that's why it is very important to keep physical distancing. And also, you don't know what is your situation before you develop symptoms. So if you have to go to a place where you cannot observe that physical distancing, wear a mask. The next one, please. Yes, that's next one, please. Next one. When you're choosing your accommodation, that you have to choose accommodation in the setting. If you have to stay there in a hotel or in a guest house, make sure that they have an established protocol for COVID-19. How you would know that they are doing something about COVID-19? First, if the staff at the reception is wearing a mask, and then there is a dispenser of alcohol-based hand rub at the reception, maybe that's a decent place to stay. Maybe they have a good protocol for COVID-19, though there is no guarantee. Of course, accommodation in single rooms whenever possible is much better than accommodation of several people in a room. Keeping physical distancing at least 1 meter from other guests and from other members of the team all the time, also during the accommodation, and avoiding close contacts with other guests and staff. Close contacts means talking face to face from less than 1 meter distance without mask with other guests and staff. That these are close contacts, but also touching other people. Observing regular hand hygiene, hand washing with soap and hand rub after contact with commonly touched objects, for example, handles or the buttons of the elevator, and observing respiratory etiquette, sneeze, cough in your elbow or in a tissue, and dispose after that, and perform hand hygiene before you touch your face. Next one, please. Avoid using elevators with other people. This should be 1 person per elevator, or very big, of course, elevators. It can be 2. but it's avoid that, take the stairs as much as possible, avoid social gathering between the members of the response team, and also socializing with other people without any physical distancing and without any protection. This is a recipe for an outbreak, and we see a lot of outbreaks, actually, work-related outbreaks, clusters happening because of social gatherings outside the workplace. Choose restaurants where there is a physical distancing between tables. The best is actually outdoors, terraces, and where staff wear masks or face shields. Avoid food establishments with crowded and closed places without ventilation. And again, prefer terrace outdoor dining areas. Do not wear personal protective equipment in the community apart from a mask. Personal protective equipment shows that you are a medical or health officer, and there is a lot of stigmatization, there is fear, people may attack you, people may be subject to violence. Next one, please. When you're working in the field, whatever the field would be, it would be in the community, or you'll be visiting homes, or you'll be visiting health facilities, or you'll be visiting different settings, keep at least 1 meter from others, and if not possible, wear a mask. And if you are interviewing people, of course, you have to wear a medical mask. Keep regular hand hygiene, washing with water, soap, carry your hand alcohol-based hand wrap, and use it particularly if you touch something, before you touch your face, nose, mouth, and eyes. And we do that at least 20 times a minute unconsciously, so it's very important to use that regularly. And do not share mobile phones or tactile devices or tablets with others. This also can be a source of transmission. And practice respiratory hygiene. You need to follow the infection prevention and control rules and use the appropriate personal protective equipment when you visit homes, when you visit different settings, healthcare facilities where there are people having or suspected of having COVID-19. And you have to follow the specific rules for collecting specimens for lab tests. Do not walk around the community again with full PPE. This is not necessary, and you may become a target of aggression and violence. Next one, please. While in the community, while you are in the setting, you have to monitor your health. You have to take your body temperature every day before you start working in the morning. Have this as a ritual. Some of the teams may be required actually to report this to their headquarters on a daily basis using the mobile applications. And if body temperature is above 38 degrees Celsius, stay in your room, inform the rapid response team leader, and do not go to work. Monitor yourself for COVID-19 symptoms, and this is fever, 35 and above, myalgia, this is muscle pains, joint pains, fatigues, headache, dry cough, shortness of breath, loss of smell and taste. These are the most common effects of COVID-19. The next one, please. A contact is how to understand whether you are you have been a contact of COVID-19. This is the WHO definition of a contact, a person who has experienced exposure during the 2 days and after 4 days after the onset of the symptoms of a probable or confirmed case. So this is face-to-face contact with a probable or confirmed case within 1 meter and for at least 15 minutes. Just saying hello doesn't mean that you have been a contact. Direct physical contact with probable and confirmed case means touching someone touching hands particularly, direct care for patients with probable and confirmed COVID-19 without personal protective equipment, and other situations that might be required by the local authorities. So if you have such a contact, you have to report to the team leader and to the member of the rapid response team who is responsible for health and safety, so they can assess actually whether this is a contact that is serious, or if there is any situation that requires that the team member should quarantine. So we have a specific WHO protocols for assessing exposures to COVID-19, and you have that protocol also in your handout materials. Next one, please. Yes, in case if you had a contact with COVID-19 and the member of the rapid response team responsible for health and safety has assessed the seriousness of that exposure. If the risk is low, you can continue to work, but of course, always monitor your temperature and monitor your COVID-related symptoms for at least 14 days after the last day of unprotected exposure. Call occupational health services or the people responsible for your health and safety of your headquarters. If you develop symptoms, then stay at home, do not go to work, quarantine yourself, stay away also from your family. At least 1 meter if you cannot have a totally separate accommodation. If the risk is considered to be high, you have to stop working with other people for 14 days. You have to put yourself in quarantine and get a test for COVID infection and get quarantine for 14 days. WHO recommends the best is to be done in a healthcare facility or a non-traditional facility, hotel, or in other places, but it can be also done at home, but best is to be done without other household members in the same room, and watch for any symptoms that may arise during that period. Next one, please. Now, everything has went fine. You did your mission. You come back to your headquarters and to your place of residence. And of course, you have to continue to monitor your body temperature, watch for COVID-19 symptoms, at least for 14 days, or at least before the next mission. But if you have been in contact with COVID-19, your occupational health service or the person who is responsible for health and safety of the staff, they should know that. They have to do a risk assessment. They have to follow up. If you experience also any mental health problem, any signs of stress, burnout, or anxiety, or you feel depressed, or you feel bad, you feel low after the mission, you have to seek help from mental health professional. Also, you have to provide the feedback on health and safety during the mission, how the things happen, how was your health and safety protected, any kind of difficulties you may have faced in observing safety protocols, the accommodation in terms of food, in terms of working in the communities on health facilities, and please give recommendations for improvement of the protection of health and safety after your mission. It is very important that your headquarters, they know what you have faced and how they can do better. Next one, please. And we are going back to the factory. And in the meantime, I think we have some time for questions and answers, right?
Yes, thank you so much, Ivan, for your presentation. Very, very informative. And there are so many questions that are popping up on the chat box. So yes, before we go to the case study, we have at least a good 10 minutes to respond to the questions that are on the chat box. So both you, Leslie, and Dr. Demba can address some of these questions.
Okay, I see it here in the chat box about security briefing. Okay, please. Security briefing, I'm sure that my emergency colleague, Dr. Lubambo Demba, is better positioned to explain to you from the point of view of the field. But security briefing is done by the security officer of your organization, and they have to explain you what is the situation in the village or the area where you're going. Are there any attempts of terrorism or civil unrest? What kind of situations you may observe? Are there any checkpoints? Is there any military interventions there? And also other security, for example, community violence, or it might be a community that is known for crime, that there are guns in the community. So they will explain that to you. It's very different from a setting to setting. Lubambo, do you want to add to the security briefing? I'm sure you do that on a regular basis. I have done that several times in Africa.
Thank you, Ivan, but you said all. So
Yes.
just remind colleagues that it's about the safety of the staff, the rapid response team. And we have to take into account the environment and the set, all the reality. So for your safety, for your security, for your, at the occupational space, you need to know before you are deployed and if during you are there, what kind of attitude you need. So that is what I can add. Thanks.
Yeah. The security situation changes very rapidly, and sometimes even introduction of lockdown measures or measures of restricting the movement of people makes local communities angry, and they can react in unpredictable way. They may introduce checkpoints, and you don't know how they will behave. So it is very important. Okay, let me see the other question. Is there a positive case in the community? Are we not required to use PPE? And well, suppose if there is a positive, yes, you should, whenever you go in the community, first, if there is nothing, you wouldn't be there. If there is no case, you wouldn't be there. But you have to use PPE and be on the safe side. Use PPE, basically wearing a face mask, wear a medical mask. A face mask will not protect you from getting the virus. A face mask, which is the cloth that people wear, this is a source protection. This protects other people from you eventually expelling the virus. But this does not protect you. A medical mask, which is fluid repellent, is protecting you from droplets that are spread through the virus. Thanks, Leslie, for answering the question about N95. You don't have to wear N95 all the time, only for aerosol generating procedures, or if you get in a situation visiting an intensive care unit, even without any ventilation, a very crowded, in small intensive care unit, and they will advise you basically on whether you need the N95. It's good to have it with you if you can, but it's not required. Definitely for low risk N95, it's not required. Which case will have high virus shedding and contributes to faster community transmission? Confirmed PCR positive with symptoms. Well, the research actually shows that the capacity of people to shed the virus is very, very diverse. Some people are, and we don't know exactly why, but what characteristics make some people super spreaders. but it's usually 2 days before the symptoms and then a couple of days after the beginning of the symptoms if the highest viral shedding. And the community transmission depends on the contacts, how many contacts this super spreader has with other people, close contacts, handshaking also, but talking, particularly talking high, loudly or singing or yelling, and this can spread the virus. Okay. Okay, should we disinfect area of workplace? I don't think the rapid response team, the task is to disinfect workplaces, or that should be done by the workplace themselves. And it's usually we recommend cleaning, just the environmental cleanup and disinfection of commonly touched surfaces. We do not recommend fogging and spraying, particularly of disinfectants. Okay. Surgical mask, it is what we call so medical mask or surgical mask. This is something that has been also certified that it protects from droplets. Okay, did I answer all the questions, Paula?
Well, I'm not very sure which case will have higher viral shedding and contribute to faster community transmission of COVID-19, a confirmed RT-PCR positive with symptoms or the positive but asymptomatic?
Oh, it can be asymptomatic, absolutely. People can be asymptomatic. People start shedding the virus 2 days before, usually 2 days before the symptoms appear. Some people are actually develop very, very light symptoms that even they're not aware that much that it can be that they have symptoms. And as I said again, we do not know exactly why some people are shedding so much of a virus while other people not. Usually 20% only of the people are responsible for the infection of the remaining 80%.
Okay, we have another one. I'm not sure this one has been responded to. What is the reason behind considering having contact with COVID-19 probable case after 14 days of onset of symptoms? To my knowledge, the maximum incubation is 14 days. So why after 14 days?
14 days, this is the incubation period of COVID-19. And we talk about probable case because the moving from a probable to recognized is only one test, which may not be available, or the person may not have taken it, so you don't know what is the situation. 2 days ago, you are probable, today you are confirmed. So it's not a mathematics.
Mm. I don't know whether Leslie or Dr. Denba, you have flagged any questions that also need to be responded to. I am also browsing. I see one. What about sample collection from the mass community by laboratory personnel?
And I think the question about low and high risk as well, Paula.
I didn't get you, Leslie. Sorry.
Dr. Chen Kwan asks how to define low or high risk.
Okay. Sorry. Okay, so we still have a couple of minutes more if you wish to see or send any additional questions. Okay, so latent period is 14 days. Yes. Okay, well, if we don't have additional questions,
Paula?
or we don't, yes, please. If there is no additional question to be answered to, or nothing else to be elaborated on at this stage, we can move to the case scenario. But here I see an additional question: difference between cloth face covering, surgical mask, and respirators. Yep. So anyone can would like to address that question? Ivan, Leslie, or Dr. Demba? What's the difference between cloth face covering, surgical mask, and respirators? No, can you hear me?
Yes.
Okay, thank you. I was afraid that nobody can hear me. So if there is any of the facilitators who would like to address that question.
I think maybe what we can say, the difference or something, what all protect against the droplet, but the difference, we can say the face mask, the surgical mask is recommended for protecting also when you have exposition to the risk, so especially for medical personnel. But for respirator, I don't know if I understand what is kind of respirator, because there are two things different. Unless there is a mask called respirators, because respirator, it's equipment for ventilating a patient.
A respirator usually means that it's got some independent, it comes with a hood, and it's an enclosed breathing space. So it has an independent engine or some way of moving the air around inside your hood. So it's your head, your breathing space is fully enclosed, and so you're dependent on the respirator to for your fresh air. Whereas a surgical mask.
Do you still hear me?
A surgical mask is
I'm
one
not
with
sure. I hear silence only.
Yes.
For PP in community, sample has to be collected from suspected people. We
Yes.
have to go
Ivan, please. Ivan,
only.
can you hear me?
Well, if you have to go and collect a sample, yes, you would wear the PPE, necessary PPE, before doing the sample collection, but do not get off the car in full PPE in the middle of the village. That is not necessary.
Okay, Ivan, can you hear me? I am afraid. Leslie, can you hear me?
Yes, I can hear you.
Okay. So I believe that Ivan cannot hear me. Okay. Anyway, so yeah, I sent him message, but I don't think he's able to hear me.
So I think that just to finish that answer, that the surgical mask or medical mask usually conforms to some standard and has multiple layers, of which the outside layer is generally not waterproof, but it repels moisture. So and the cloth mask is something which is as it can be homemade, it can be of various types. It's just to cover your mouth and nose. So again, it's more prevents you infecting someone else than the other way around. So it goes on a spectrum: a cloth mask, surgical mask for medical personnel, and a respirator for the most high-risk situations where you have a lot of aerosols and potential viruses being generated. Hope that clarifies that.
Thank you so much, Leslie. thanks to all for the questions and for addressing them as well. Of course, we won't be able to address them all because they still come in the chat box. But what we can propose is that this discussion can continue also on the Rapid Response Team Knowledge Network. If you want to join, at the end of this webinar, we will provide you with the link to join the Rapid Response Team Knowledge Network, and so. The webinar is not the end of the discussion, I would say. As we are going now to move to the next step of the session with a second step for the case study that will be presented by Leslie. I'll give you the floor, Leslie, for this the second step of the case study.
Okay, thanks, Paula. So the second case study builds on a number of the things that Ivan presented in the PowerPoints. So now it's after you've got back, you're part of the rapid response team, you've returned after investigating the factory, and you hear that one of your team members has developed a fever and dry cough. And she has been tested positive for COVID-19 on arriving back at her home duty station. So the next few questions are designed just to test understanding of some of the material that Ivan presented. So the first question, Silvio, the first question is, which of the symptoms that have been shown by the rapid response team member would have led to the testing of this team member for COVID-19? This is a multiple choice question, so please highlight any of the options that you think would be classical symptoms of COVID-19. Thank you. So we've got 6 people already responded. That's good. Let's keep it up. I think that you're all probably very familiar with this answers to this question.
Let's try to have 80 people. That would be nice.
Competitive here, Sylvia.
Yes.
Yes.
I think 40 is quite good. Okay. We can, yeah, let's look at the responses now. I think we've got quite a good response. Okay, let's see the answers then.
Okay. 63.
Okay, so yes, fever is the most common symptom. Muscle pain, joint pain. I think probably it's the name arthralgia that maybe is putting a few people off there, and fatigue. Diarrhea is not a common symptom. Dry cough, yes. Headache, insomnia is not a key, another key one, and shortness of breath is. So I think that headache was not necessarily recognized, and the joint pain, I think it's a terminology there that's arthralgia may have confused a few people. So those are the common symptoms: fever, muscle pain, joint pain, fatigue, headache, dry cough, shortness of breath, and this loss of smell and taste. Okay, let's move to the next question.
Okay. Quickly, we have a leaderboard, so we can see that Suze is the first one, and then we have Keikin, Siule Mar, Budimaya Limbu, Nai Yilin. And sorry for my pronunciation. Thank you. Okay, next.
Well done to those.
Well done, yes.
Yes.
The next question is, so we're now still in the same scenario. So you've heard that one of the team members have got tested positive, and what are the conditions under which other members of the rapid response team should be tested for COVID-19? And again, it's a multiple choice. There's just four possible answers. There's maybe more than one correct one. So let us know what you think here. So what are the conditions under what conditions should other members of the team be tested?
So Silvio and Leslie, we do have time to wait until we have a sufficient number of responses. So let's take the time, because we are good with time management today. Thank you.
Okay.
Hello, colleagues. Please ensure that your mics are muted during the session. Thank you very much. Okay. Okay.
71.
I'm sure we'll get 100. Let's get to 80 and look at the answers there.
And we also have some people responding on the chat box, those who may have not been able to join the Slido. So we have additional responses here on the chat box that we can check.
Right, that's good. Okay, I think let's look at the answers now, because I think we could probably then discuss them a little bit more.
Yep.
Here we are.
So yes, I think that most of you have identified correctly that so you need to check back with the other team members that were part of your team to find out if anybody else is experiencing symptoms which are consistent, and we've identified those in the last question. So any of your colleagues have got symptoms and they should be tested. It's not necessary to test all members of the team, but you would be able to identify those which have been in close contact with the symptomatic team members. So perhaps they've shared a vehicle to get back to the airport. Maybe they've shared the accommodation and have socialized together at meal time, and maybe they've been doing the same task at the site. So you would only need to test the ones which have got close contact, documented close contact with the symptomatic team member. So there's no need to test family members of all the team members. Again, it would be driven by those with symptoms or with a history of close contact. Any questions about that? I think most people understand that. Shall we move to the next question?
Yep.
So the final question is, so you have this team member who has been tested positive and has got symptoms. How long should that team member be quarantined?
It seems it's quite easy now, especially after the presentation we had just earlier.
Oh.
Okay, so let's look at the answers to this one. We've got a good response, the biggest response. Yes, everybody, or most people have correctly identified it should be 14 days after the last contact with the infected team member. So
Yes. Just an observation, Leslie and all. In the chat box, we have colleagues responding that in Bhutan, for example, it is 21 days that is required for the quarantine. So it seems that it can vary according to the different contexts and criteria, probably.
Yes, for sure, for sure. In some countries, it's 21 days. So we usually say between 14 and 21.
I'm sorry, I have to.
Right.
One moment.
Okay. Okay, excellent. We also have a couple of additional, let's say, responses. I think it's probably to the previous question, but we have a person here who is stating that usually all rapid response team members work closely, and thus they become close contact of the positive case. Therefore, I believe that all rapid response team members should be tested. Conservative approach. Cheers. So probably we can here remind of what we consider as close contact. This can probably clarify a bit more. In which situations do we say that somebody is a close contact, Leslie or Dr. Demba or Ivan?
A close contact would be someone who's spent time with the infected person or has been, there's not been closer than the 1 meter, and so they've been working closely together, or they've been, as I said before, perhaps traveling together in a vehicle, or spending a large amount of their time with that person in close proximity, so closer than the social distancing distance. Ivan, do you want to add to that? I don't know whether Ivan can hear us still, or Dr. Demba.
Mm-hmm. Okay, and we have Leslie and colleagues, we have still a few questions that are popping up on the chat box. Probably you can have a look because we have a few minutes more that enable us to address a few concerns more. If you want to have a look at the chat box and see what you can pick and address on the questions that are just being asked.
Well, I see that there is a question of isolation versus quarantine, and these are two different things. Quarantine is for contacts, and isolation is for people who have the disease, who are confirmed cases. So these are two different things. Then, all right, there are also questions about what counts as a close contact. Close contact means having unprotected contact without masks for both sides. Talking to a person face to face or being close, less than a meter, and it is also some minimum time. It's around 15 minutes, though it's just a rule of thumb, the 15 minutes. If you have been 14 minutes in talking to that person, it still would be a contact. And also physical contact, shaking hands, contact with respiratory secretions, contact with contaminated objects, with healthcare waste, contaminated healthcare waste. So these are considered contacts, and in different countries also, they have different definitions of contact. So you have to apply also the local definitions. WHO has a minimum definition, but the countries may have additional layers of definitions. And the same is about the quarantine, whether some countries have 7 days or 10 days. On average, WHO recommends 14 days. Some countries have shortened that for the purpose of the economy and allow people to work. But on average, it's 14 days. Some countries, Bhutan, can allow probably 21 days, and other countries can allow longer periods. This is what I can add to the questions that I can see.
Thank you very much.
From the colleagues in Bhutan about the 21 days, how the 21 days has been arrived at. It's the longest I've come across. Usually countries are shortening it rather than lengthening it. So it would be perhaps interesting to hear from our colleagues in Bhutan, giving some background there.
Okay, so thanks to all for your contributions, for your questions, for sharing the experiences and the ways the various measures are taken in the different countries. We have sometimes the slight variations in terms of the measures that are recommended, and this is the reality in the field. I propose that now we move to the next step, which is having a wrap up of the content, let's say, and having the key messages, the key learning messages, the take-home messages from the webinar. For that, I'm going to pass the floor to Dr. Lubambo Demba.
Thank you, Paula. Thank you very much, dear colleagues. We are going to take this as a takeaway message. So the key message from this webinar, we can say that the key risk on health and safety of rapid response team are usually assessed before the deployment, during the response, and after the rapid response field deployment in COVID-19 context. So as it said, before you are deployed, you have to assess all the risks. And when you are working, we need to have to be alert and to continue assessing the risk, and even after. Secondly, we can say health and safety of rapid response member may be at risk at any time during the deployment. And then it needs a daily monitoring of preventive measure to protect safety of responder and maintain team spirit and motivation. I think this also is linked with the need of designating one person to be really involved and in charge of the safety of the rapid response team. So every day we need to monitor, we need to be sure that all preventive measures are applied and everybody is still alert, and also to keep the team spirit and also to make sure everybody is still motivated and there is no confusion regarding the risk or the exposure. We can also application of protective measure for the rapid response team is a top priority. As you know, you are the responder and your health and your safety are priority for your own family, yourself, your organization. So we have to insist that the protective measure is a top priority during the COVID-19 pandemic response. And for this, we need the total cooperation of the rapid response team members. So let's say we've gone in the preparation, personal preparation before, team preparation. I think Ivan went also all the process, transport, accommodation, food. And then we say when you are responding, there is some measure you need to respect. There is a way of working in the team. And as you know, the rapid response team, it's a multi-sectoral team. And we have to make sure that on daily basis, we are monitoring your situation, your health, and you're still protected. So that's what we can say in terms of summary on what is the taking away message. Maybe we can go to some question and see what else can be needed by the rapid response team. We can also add on this that during this deployment, as we said before, the incident you are investigating itself can constitute also a risk for you. The team also, the way of working can also be a risk. The environment in which you are working also can be a risk. So all of this need to be taken into account and make sure that we are protected. We are able to continue what the beneficiaries are expected from us. And we are making sure that when we'll be back, we'll be safe. And in case there is any problem, we have to need support and to be also protected by ourselves, by our family, by our organization. That's what I can say in terms of summary. I don't know if some colleague can add or if there is some question on the chat.
Yes, Dr. Demba, we have a question that has just been raised in the chat box that's about mental health. Who is responsible to manage or address mental health issues occurring amongst the rapid responders? Team leader or safety focal officer, or who else?
Yes, good question. I think, as I say, the rapid response team, it's a multi-sectoral health. There is a person dedicated to follow the safety of the staff of the rapid response team. And also this person is working in collaboration with the team lead. So I think it depends. If there is a specialist in mental health, it's the one also working, taking care of the staff. But I think the rapid response team report also to the team lead, and who can escalate the request and the support. But after the deployment, I think the mental health, it's the personnel, the specialists in mental health in charge of supporting the staff. But during the response in the field, there is a division of tasks. And I think Ivan can add, but the final responsibility to escalate it is the team lead of the rapid response team.
Well, if I can add that all team members actually should have the basic skills for first psychological aid. This is a skill that is required for all humanitarian response personnel, and they may have to provide first psychological aid to members of the community or to their co-workers. And WHO, we do have resources about for psychological aid. It is not a rocket science, it's a very simple. And in the field, this is basically what anybody can do for a colleague if they see someone is not feeling very, very well, or someone had a tragedy, or someone is crying, or someone is depressed, that can be addressed. Of course, after returning back, if the situation continues, that emotional distress continues, that may need a specialized intervention by a mental health professional. But in any case, discretion should be observed, and confidentiality also. So it is a team, and they have to be able take care, of course, the support inside the team and to looking after the health and safety of your body, of your colleague inside the team is also very important. Over.
Thanks very much, Ivan, for completing this answer. And also just to, let's say, to close probably with the question and answers that participants are raising here. There is an observation about by a couple of participants to the webinar about something that was said in the questions and answers during the case study. The observation is about diarrhea. That seems to be one of the new symptoms for COVID-19. What can we say about that? And diarrhea wasn't part of the symptoms that were the right ones on the case study. This is why this observation is made here.
Right. Well, there is, in terms of a disease, there is no yes or no answer, or right or wrong answer. Diseases, they show with a lot of symptoms. So in the quiz, basically, these were the most common symptoms that are the signature of the disease. There are also neurological symptoms. There are other symptoms, including diarrhea. It can come, but it's not the most common symptom. It's not the signature of the disease.
Okay, thank you. Thank you so much for this additional input, Ivan and colleagues. So let us now move up to the next step. Here, you will find at the end of the presentation that will be shared after the webinar. You will find a series of interim guidelines and also online training and training manuals that are recommended as far as occupational safety and health is concerned. So you have available courses, and you have courses who are going to be launched soon in English and French, especially one I see in OpenWHO, which is not yet available, but you have in the Health Security Learning Platform, you have a course on occupational safety and health in English, French, and Spanish that's already available, and hopefully some of you participants have already been able to complete it. If not, you are still on time to do it, because this topic is extremely important when it comes to field responders. So before we close the webinar, we will invite you all to evaluate the webinar. There are a set of questions that to be responded to. It's very quick and very simple. So we would be grateful to get your feedback on the webinar. And you can now use Slido again to evaluate, and you will need to scan the QR code again or type again in the browser. Okay, yes. So the questions are quite simple. Did this webinar respond to key questions and challenges you encounter in the field? And the options are yes to most of them, yes to all of them, only to some of them, or no to none of them. Second question is, please indicate to what extent you agree with the following statement. This webinar enabled me to learn something new thanks to the examples and experiences shared by facilitators and participants. Agree. Please indicate to what extent you agree with the following statement. This webinar enabled me to consolidate my learning regarding risk to my health and safety and ways to mitigate them in the context of the COVID-19 pandemic. Silvio, the evaluation is still open, right?
Yes, yes.
Okay.
No problem. We see that we have 58 right now.
Good. Question 4 is, please indicate to what extent you agree with the following statement. The methodologies and tools used during this webinar were good and facilitated my active participation. Okay, and some people are responding on the chat box. Thank you. Thanks to all those who are responding in the chat box. And then the final question is the overall rating you would give to this webinar. So let us give still a bit of time to participants to have a chance to complete. Okay. This is not displaying in the Slido. Yes, now for the evaluation, which is a bit of a different thing, you have to scan the QR code again or type slido.com and the password is a new password that is eval. You can see that on the screen here. Okay. Okay. Let us give a couple of minutes more and then
I think some people replied to the first questions and not the last question. So that's why we have
there is a discrepancy. Yes.
Yeah.
Okay. So I don't know if it wasn't probably clear enough.
So we have about 80 people anyway who
were able to respond.
Yeah,
That's
81. So it's good.
Thank you. Thanks to all for your input, for your responses. And I'm going to get back to the presentation for a very short while. So yes, because I want to remind everybody that the webinar series will end up next week. And Tuesday, 27th of October, we will have a the fourth webinar in data management and dissemination in the context of the COVID-19. And this is for the English session, and then for the French session, it's going to take place on Wednesday, 28th of October. So we invite you all to join. And also there is a question about, as Philippe presented when we started the webinar, we also plan to conduct 2 additional webinars in November. The topics are still to be determined based on your vote. So I kindly invite you all to vote for the topics that you see as most relevant and interesting for you. And then you have to know that at the end of the webinar series of October, we will be providing you with a link to access an evaluation of learning. So there will be an evaluation about that will cover the 4 webinars, the 4 topics that we're elaborating during these webinars. So the first one being active case finding and contact tracing, then community engagement, occupational health and safety, and the 4th one, data management and dissemination. There will be an evaluation that will integrate all of these topics. And at the end of this evaluation, the successful participants will get certificate of completion of the webinar series. So, but this will be done after the at the end of the 4th webinar. And then to finish with, our colleague Katrina, who presented the Rapid Response Team Knowledge Network, had to leave us for another activity that she's organizing now. But I am just reminding you and presenting you here the link that you can use to join the Rapid Response Team Knowledge Network in MS Teams. So please feel free to join the network. You can have in this group many opportunities of continuing this discussion and other discussions that are relevant to rapid response teams. And you can share your experiences, and other participants from members, I would say, from many countries share also their experiences, their challenges, the guidances they publish. You have a lot to gain to join the knowledge network. So I would like to thank you all participants. I would like to thank our facilitators, Leslie, Ivan, and Dr. Demba for being with us. Of course, Sylvia also for the facilitation. And if you want, we can all probably now open the mics and the videos to say goodbye, as we are now reaching the end of the webinar. So thanks to all, and hope to see you next week on the next webinar.
Bye-bye.
Thank you.
Bye-bye.
Bye-bye.
Bye. Thanks.
Thank you.
Thank you. Bye.
Thank you. Bye-bye.
Bye.
Bye-bye.
Bye.
Thanks. Bye-bye.
Bye.
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 طبقونا يا جماعة. هذا مرتين ما فاتح الكاميرا. باي باي.
Hey, Nobty. Bye. South Africa is also represented.
Yes.
Thank you, South Africa.
Well done, South Africa.
Bye.
Well done, Bhutan, Myanmar, Niger, all of the countries.
Hey, what Papa man?
Many people.
Thanks. That's nice to see the faces of everyone.
Bye-bye from
listening.
Myanmar.
Okay, thank you, Myanmar. Thank you for coming.
Okay, thank you all. See you soon. Bye-bye.
Thank you. Bye-bye. I'm going to end the meeting now.
Bye-bye.
That's going to end the
Thank you so
recording.
much.
Thanks to you.